following program is classified G. It's suitable for all ages. We would like to remind our viewers that the views expressed in this program by our participating guests are solely viewpoints of them who take part and does not reflect the views and beliefs of the Derana Media Network. This is an opinion-based program.
Most recently, a series of protests which have spread across the world against COVID-19 restrictions have sprung up, most notably in Canada. Prime Minister Justin Trudeau is facing massive backlash and is called on to axe regulations. The inception of the protests have been the imposition of a vaccine mandate on the 15th of January, which requires cross-border truck drivers, which is between Canada and the United States, to quarantine when crossing from the US to Canada. The protests from blue-collar employees within Canada have raised concerns even within the United States as well as to whether a similar effort would be witnessed there. The call from the Canadian truck drivers has been to lift all COVID-19 restrictions put in place, specifically the vaccine mandates. This protest, which has been identified as the Freedom Convoy, has been growing in European nations as well, such as in France, Germany and Italy. Many of the protesters are upset about the respective government's health pass, a vaccination requirement that has shut out the unvaccinated from public life. The series of protests in France is to continue in Brussels, Belgium tomorrow. In December last year, similar protests were witnessed in Spain against the vaccine passport. Early this month, Austria passed a law amidst heavy resistance that makes vaccination against COVID-19 compulsory for anyone over the age of 18. Austria's government resonated a similar sentiment to that of Canada as well, when it suggested that vaccinations are effective at combating severe disease and that the law is needed to prevent future lockdowns. Right-wing media stations have been very critical of the enforcement of mandates, given the harm to the people's freedom of choice.
Now, needless to say, Joe Biden's not particularly happy after fully endorsing the summer riots of 2020 that left, dozens dead, caused billions in damage, property damage, arson and looting, and thousands of cops injured. Now, all of a sudden, Biden, he's now urging the Canadian Prime Minister, the gutless, cowardly Trudeau, to squash the peaceful Freedom Convoy in Ottawa, apparently by any means necessary. In a call, Biden and Trudeau agreed that these truckers at the border pose a serious problem, and the Canadian Prime Minister promised, quote, quick action on enforcing the law.
You saw Justin Trudeau smear, slander, attack, name call. Very interesting to me to see how the Biden administration has so far not gone in aggressively, but rather with an open hand. I'm not saying they're handling it perfectly.
They can't. Oh my, I mean, Ezra, after the way they backed the BLM protests, there is no chance that they can come down on this. I mean, it would just be so grossly hypocritical.
Here is Justin Trudeau, handsome Bernie Sanders, explaining that we need mandates, because if we don't have mandates, then how are we going to avoid further restrictions? You see, we have to curb liberty in order so that we can have liberty. Now, this has been the case that Democrats have been making all throughout the pandemic. And you know what caused them to lift the mandates in the United States, as we'll get to? What caused them to lift the mandates was not the changing science. What caused them to lift the mandates was not following the data. What caused them to lift the mandates is that the American people finally said no. You're starting to see the same thing in Canada, so good for the truckers.
The Canadian Trucker Convoy is the single most successful human rights protest in a generation. If nothing else, it has been a very useful reminder to our entitled ruling class that working class men can be pushed, but only so far. When they push back, it hurts. It turns out that truck drivers are more important to a country's future than, say, diversity consultants or even MSNBC contributors. Who knew? The White House has no interest in knowing.
Singapore has provided a unique example of how it is handling the communications aspect of COVID-19, given its trickle-down effects. Medical professionals in Singapore have stated that they are not worried about a rise in cases, given that most parts of the population are fully vaccinated, and the short-term effects for fully vaccinated people is quite minimal. Professor Teo Yik Ying, Dean of the National University of Singapore, So Swee Hock School of Public Health, has been a very vocal supporter of not reporting COVID-19 deaths, as it is not generally done to other diseases. He has gone on to suggest that most countries don't test COVID-19 patients with no symptoms.
I actually think that it really isn't the number of daily cases that matters anymore. After all, case numbers are directly influenced by how a country tests contact trace, and how a country report the cases. Some countries actually have stopped testing people with no symptoms and changed the way they test as well, relying more on ARTs rather than the PCR test. Now, some people have been worried about the number of COVID deaths that have happened in Singapore over the past 3-4 weeks. Now, I think it's important to start off by saying every death is regrettable, and even more so when many of them could actually have been prevented with vaccination. I do also believe we need to change our mindset towards this. We don't report on a daily basis 16 deaths happening because of cancers, 12 deaths happening a day because of pneumonia, 11 from heart diseases, 3 to 4 from stroke. But we are doing this right now for COVID. And actually, I have to say, this is striking fear in the public against COVID-19. So such headline reporting may be important in the beginning to highlight the dangers of infections when we were completely unprotected. But now we can be protected very well by vaccines. We really do need to change our mindsets towards infection case numbers and definitely towards COVID deaths.
Denmark was the first European country to lift COVID-19 restrictions, whereas Norway, Sweden and Czech Republic followed.
If we look at the case of Norway, we have lifted numerous restrictions, as have Denmark and Sweden, because we are in the phase in the pandemic where the cost of the restrictions really outweigh the burden on the health service. So each country has to make its judgment on that national call.
The stop to testing approach was taken in Sweden last week, where wide-scale testing for COVID-19, even among people showing symptoms of an infection, was stopped, putting an end to the mobile city square tent sites, drive-in swab centers and home-delivered tests. The reasoning behind it, amongst others, has been the unproportionate cost that goes to testing, which could be used to treat patients. In 2021, the region of Stockholm alone spent the equivalent of more than $446 million on PCR tests. Sweden's Prime Minister, Magdalena Andersson, announced prior to lifting restrictions that, quote, the pandemic is not over, but we are headed into a new phase. From Thursday last week, people in Czech Republic no longer have to show COVID-19 passes to gain access to bars, restaurants, cafes and hairdressers, as well as sports and cultural events. The reasoning for these actions by Scandinavian countries and other European nations has been that even though the Omicron variant has caused a spike in infections, it has not translated into an increase in hospitalizations for severe forms of the disease in a country where the population is widely vaccinated. It is in this backdrop that Sri Lanka should understand the novel trends in how the pandemic is being dealt with. Most nations have identified these trends and let go of fear-mongering, which has served no proper purpose.
A very good evening, everyone. Welcome to Get Real. If it is Monday, well, then it's time to get real. Tonight, our discussion is pausing on the events that's occurring here in Sri Lanka and actually looking outwards into the entire world. The whole world for the past 2 years has been experiencing a global pandemic. We all been sharing one kind of a problem, that is a health scare that has pretty much dictated how we live our lives. Now when we talk in schools and all, we will be teaching our students saying before COVID and after COVID. It was before Christ and after Christ. Now we have a pandemic to differentiate our time frame. In order to get an understanding, tonight I have a very special guest, Mr. Jagan Chapagain. He is the Secretary General of the International Federation of Red Cross and Red Crescent Societies. Good to see you in person, Jagan. Last time when we spoke, it was over Zoom, and the world was pretty different at that time. And here we are, have the ability to sit across the table and have this discussion. And I also feel a real special today, you coming up and visiting me in person on Valentine's Day. Good to see you, and welcome to Sri Lanka. So, how are things? What's happening? What's the world's take on COVID as of now?
No, first of all, thank you for having me. As you said, it's good to be here in person. And it's really good to get real on a Valentine's Day. So I'm very pleased that I can be here to speak with you. As you know, since last 2 years, as you said in your introduction, that the world is living with COVID-19. We started the crisis knowing very little about the virus and its impact on population. I think the science moved very, very fast. And there have been, of course, significant progress on the science. We started with the testing and later on with vaccinations. And we have also seen the virus mutating and changing, as we saw during the second wave. The Delta variant was much more contagious and deadly. Now in Omicron, we have seen that it's been very contagious, but probably not as deadly. So we have seen this huge changes and evolution on COVID-19. So from the health point of view, at least in the developed world, there has been a significant progress on vaccination, and clearly the vaccination is helping the mortality significantly. Of course, there is a significant inequity around vaccination in the developing world, particularly in Africa. The vaccination rate is hovering around 10-15% still. And as we saw in Omicron, starting in South Africa and reaching Europe within a few days, without that global equity in vaccination, it will be very difficult to say that we are safe, even in the developed world, even where the vaccination is more than 80%. So we are in a bit of a mixed situation here. Great progress in science, great progress on vaccination, particularly in the developed world, but on the other hand, still a huge vaccine inequity. That means prolonging the pandemic. That means the fear of new mutations happening, and the gains, some gains that have been made, could be lost very rapidly. So from the IFRC, what we are asking for is more global solidarity to ensure that this huge vaccine inequity is addressed, because that's the only way we can overcome this current crisis.
When this entire pandemic started, like 2 years ago, we were told that, this is something we need to fear. Go inside your homes, do not come out, forget about the way you lived your life before, everything is going to change. But as things started to develop and we start to understand this virus, how it mutates and how it continues to function, we understood that it's not about fearing it, it's about understanding it and pretty much finding a new methodology to live with it. So is that a message that is resonating all throughout the world, or is it just in certain quarters of the world that is thinking in this capacity?
Going back to 2 years ago, of course, when the virus came, the knowledge was very limited. So in many ways, the decision makers were making decisions on the basis of a very limited information. And when you have a limited information, generally the decision makers go on the side of the caution. And I think that's what happened. And as we saw, many of the lockdowns that were imposed were done without much of a preparation. So, we had the stories of people saying that, I'm trying to prevent COVID-19, but my children are dying because of hunger type of situation also came. So I think the world has gone through a huge learning process in a very short period of time. So even after 2 years, I think the data is just 2 years long. And in the medical science, you need a much longer period of data and analysis to be more certain about the prediction. So while we have now much better information, I think we still don't know everything, and we will need to continuously gather the data, analyze the data, and make the decision. On the issue of how do we now behave ourselves as a human being in the COVID time or post-COVID time, if there is a post-COVID time, it's exactly what you said. I think the fear is not a solution. You cannot fear and lock yourself down at your home. You cannot lock down your population forever, and you cannot lock down your economy forever. So understanding the situation, getting up to date with the information, and taking very simple precautions, which you can take. I think I have been one of those sort of traveling around the world, taking precautions, and still staying safe. So it is absolutely possible that we have to conquer the fear, but we still have to understand and manage the virus.
So, Jagan, let's talk about Sri Lanka. You are traveling to all parts of the world. You've been to, I think, the United States, South America, Africa, Europe, and all these areas during COVID time, and trying to figure out what those countries are going through and how this pandemic is impacting them in a different way to those cultures, but we have similar problems. How do you compare that particular information with what's happening here in Sri Lanka? How do you see Sri Lanka at the moment?
I think in many ways, the countries have gone through a similar experience. Similar experience in the early days of uncertainty, lack of knowledge, and degree of fear. So many countries went through that. And people sort of thought that after the first wave was over, that maybe it is over. And then the second wave came and hit very hard in most of the countries. So in many ways, you see those similarities. But at the same time, the countries have responded also very, very differently. So you will see that differences also. Of course, in case of Sri Lanka, being in some way an island country, in some way was easier to manage the border. When there is a land border, it's slightly more difficult to manage. So in some ways, Sri Lanka was in a slightly advantageous position when there was a wave of border control. Of course, we don't know for sure whether that strategy was very successful or not, but at least at that time, that was the belief that the border control played a very, very important role. But one thing I find a bit different in Sri Lanka, and of course with my long association with Sri Lanka, has been that sense of solidarity in the country is very strong. I mean, we saw that in every country, but I think Sri Lanka had that history of solidarity, especially what we saw during tsunami. When the country went through that very tragic disasters with devastation of life and livelihoods and economy, but the country came together. The international community came together. And that solidarity to help the people who need the help basically helped country recover out of that tsunami. And I could see the similar type of solidarity. And I was really impressed to see the volunteers of Sri Lankan Red Cross going out, supporting the police, the security agencies, the hospitals, the schools. And that was a very, very important element of expressing solidarity. And I think that was key in managing the situation in Sri Lanka. I think the other aspect, what I feel very important for any country, but a country like Sri Lanka, which is of course the tourism is a very important part of life in the country. So balancing between the health measures and the health safety versus the running the economy is a very, very difficult balance. And I think that Sri Lanka has more or less managed to maintain that balance. It's good to see the tourists are a little bit back in the city. I could see in the restaurants and the hotels. So bringing that balance is very, very important. And why I'm saying this is, of course, we look at the COVID as a health issue, but the impact of COVID on non-health issue is very significant. Of course, the issue around the socioeconomic impact, the issues on the families and the relations, issues on the mental health, issues on education of the children are very significant issues. So for the decision makers, getting that balance right, which I know is not very easy, but is extremely critical for the overall development of the country. And I could see Sri Lanka trying its best to bring that balance.
One of the things that the Red Cross do, the Red Cross and the Red Crescent societies all around the world, I think over 192 nations where you all are present, what you all try to do is to help governments societies, people in those nations to recover from a crisis. So it is always attributed to whether there is a natural disaster or a man-made disaster, some calamity that occurs. The local branch or moves in first, then there is that international support, coordinating effort and all that occurring. Now in this scenario, it's not just one nation, it's the whole world. So that 192 itself is pretty much affected. How do you balance this? Because you, I think I asked this question last time also when we spoke on Zoom, you were coming at exactly the time the pandemic started. So as a new Secretary General who is pretty much taking the reins and understanding, oh my God, I'm in this mess, and 2 years down the line, what can you say? What have you learned? What has made you to look in a fresh perspective? Because earlier on, it's always, yes, there's a disaster. Okay, we have a process. We put the appeal. We do this. We do that. And that is now 192. Everybody's screaming in one voice. We need help. We need help. How do you balance that?
I think this is a very, very important question you raised, because as you rightly said, when there is a big disaster, even like tsunami, you have rest of the countries coming to help. We could mobilize resources and expertise from all around the world. At this time, we couldn't. So we have to completely change our response modality, and that's what we did very rapidly. The first thing we realized is that we cannot mobilize experts from outside the countries. So that means we had to go and tap into the trained manpower in each of the countries. Thankfully, in the last 20 years or so, we had invested heavily in building the local capacity. And that local capacity came very, very handy. So one big lesson learned is invest in local capacity. Of course, the international capacity can come to complement, but you cannot solely rely on the international capacity. The international capacity have to be complemented. So that's the first thing. And we were, I think, very quick on adjusting to that. The second thing what we realized was, as this was affecting literally every country in the world, we put a huge emphasis in the domestic resource mobilization, both human resources but also financial resources. So we changed our modality of appeal. We used to do international appeal before, but this time we combined international and domestic into one. That's one of the reasons, we reached around 2.8 billion mobilization of the resources, and 75% of that resources were mobilized domestically, and only 25% was mobilized internationally. So what we did there was, the countries which struggled to mobilize resources domestically, we use the international resources. So in some way, the international component of the fundraising helped to address the inequity in fundraising, if I can put it that way. So this investment in the local capacity was a very critical change we had to make. And the second thing was developing this federation-wide, the global approach, and expressing that solidarity was a very, very important element. And I think the third element, what we very quickly realized was caring the carers. Because generally in the previous disasters, we always put emphasis on volunteers and staff going and helping others. But in this crisis, it was extremely important that we also need to take care of the volunteers and staff who are actually taking care of others. Because if they get sick, then we don't have people to go and help others. So we had this tremendous balance to, while we help others, we had to help the helpers. And this has been a tremendous lessons learned, and we intend to keep this learning. One of the things I have consistently said, and I think today is Valentine's Day, so I want to highlight that part, is, and that part doesn't get always recognized in an organization like ours, is when the volunteers and the staff go and help everybody. The biggest volunteers I find are the family members. And they don't always get that recognition.
Sure.
Without that support of the family members, when there was so much fear in the beginning, the family still supported people to go out. It was already February 2020, within the first month of the pandemic, our first volunteer died in Italy. But the families were still supportive of these volunteers and staff to go out and help. So a huge recognition to the family members of all the volunteers and staff is very, very important. So this caring for the carers is a huge lesson learned.
Well, a lot more to discuss with the Secretary General of the International Federation of Red Cross and Crescent Societies, Mr. Jagan Chapagain. I'm in conversation with him. This is Get Real. We'll be right back. Welcome back, everyone, to Get Real. I'm in conversation with the Secretary General of the International Federation of Red Cross and Red Crescent Societies, Jagan Chapagain. Jagan, now one good experience that the Red Cross the world over has is not just helping during the time of the crisis, but what happens after that, because that is where the real crisis occurs. Economic, social, livelihood, all these things are very synonymous with the Red Cross and the Red Crescent movement, because this is what you all work all throughout. Now, what do you see in terms of this crisis? Because the entire world is affected. The entire world's resources are stretched, and the entire world needs to rebuild. So what is exactly, what are you seeing, and what are you thinking in order to meet these requirements as we move on?
This is a very, very big issue for the policymakers and the decision makers moving forward. I think one of the huge impact of the COVID-19 has been on the socio-economic field. Of course, many of the countries' economy have been severely strained. Now, what will happen is, as the governments start relaxing some of the measures put in place, I absolutely believe that the economies at a macro level will start rebounding very, very quickly. As we have seen in some of the countries, when the economies are opening, they are rebounding very, very quickly. So at a macro level, I think the economic progress would be very rapid. But the big risk there is the most vulnerable gets left behind. So one of the very important elements of this recovery process would be for the government and for the policymakers is to make sure that the most vulnerable are not left behind in this recovery process. So the inclusive recovery is very important.
Like who, when you say most vulnerable, what kind of people are you talking about here?
I mean, this could be a number of categories. One is, of course, the financially weaker section of the communities, and of course it's a bit different in different countries. These are the people somehow excluded in the development process for various reasons. The people living in informal settlements, for example, people living in slums, migrants populations, or the refugee populations, or in some countries purely the social exclusion, let me put it this way. So, and these populations are quite big in many countries. And if these people are excluded from the development, and maybe in South Asia, the one category of people which is very important category is the daily wage earners. And because COVID has completely disrupted their way of living. So special attention needs to be paid for a decent recovery of the country. You cannot leave a huge section of the society behind. And that is something extremely important for the policymakers. And from the Red Cross point of view, because the crisis is so big, our contribution would be a modest one. And we will be focusing on the most vulnerable of the most vulnerable, really to fill those gaps. And there, our approach would be supporting them through a livelihood angles. And that livelihood angles could be through a cash support, but also could be more traditional livelihood support. But it will be a very, very modest contribution. So the leadership will have to come from the governments, and the big private sector would be, and then of course the international development institutions will have to play a very, very big role. That's on the economic side. So my belief is economy will rebound very fast, but we should not leave the most vulnerable behind. But a bigger worry, in my view, is the impact on the mental health of the population. We still don't know the extent of the scar, the mental health scar this crisis would be leaving behind for a massive population, and especially in the young population. Its impact on education is another one. We still don't fully know what is its impact. And that's where I think the experts and the policymakers will have to pay a very, very special attention, and ramping up the mental health support would be very important. And from Red Cross point of view, we are beefing up our mental health capacity. As you know, we have the mental health reference center in Copenhagen in Denmark, and we are ramping up its capacity because we realize that the more and more countries would be seeking for help on that aspect. And finally, we also have to look at the institutional impact COVID-19 is having. Many NGOs have closed down during this time. Many small businesses have closed down during this time. Many the institutions have been severely impacted. Now, how do we help these institutions recover would be another big element. And one of the things from the IFRC we have been highlighting is, while the pandemic is so much on our face last 2 years, there is a bigger crisis, and that's the climate crisis. And Sri Lanka is one of the countries with the highest risk. I think it's within the top 10 countries of the high risk of the climate. So while we are focusing on the COVID recovery, it's very important that the COVID recovery is climate smart. So we cannot take a risk of doing a COVID recovery in a way that it actually have a negative impact.
But there is an issue, because this, I think I read about a couple of days back, the amount of the disposal, the garbage disposal that has been collected these days, the face masks, the PPP, the protective gear, everything. Now this is, it is being used like billions on a daily basis, and it is just dumped somewhere. We don't know what the impact of that is going to be. We don't know how many animals we will kill from that, or what kind of oceans we will pollute out of that. Is organizations like the Red Cross thinking on issues like that, the things that the people do not see on a daily basis, because we are more focused on making sure that we are safe today and not thinking about in another 10 years, 15 years, 20 years down the line? What do you see at the moment?
This is exactly the point I was making. You know, while we are trying to respond to the COVID-19, let's not forget its impact on the climate and environment. And as you rightly said, we still don't know the full impact of it, because the immediate focus has been on COVID-19. Actually, in a number of countries, the national societies are already running the campaigns on a safe disposal of the masks and all those type of things. But it is not at the scale that is required. And there needs to be a bit more research on its potential impact on the environment. And as I was saying earlier, this recovery has to be climate smart. And because there is so much resources also being available also on the climate side, and there are resources available on the COVID side, so they cannot go in parallel. There has to be a much better coordination on how the resources are spent. But clearly, on the public advocacy and a community mobilization to use them in a safe manner is the work Red Cross is doing and will continue to do.
When we were going through, initially when we had the COVID-19 global pandemic and we got to know about it, we talked about it, we understood that this is 100 years after the previous one that we had. The previous one, the Red Cross and the Red Crescent was there. When the previous 100 years ago, when that occurred, the Spanish flu and all that global pandemic was occurring, the Red Cross was there, the IFRC was there. So what can you say that your institution has learned from something? Because apparently what we've learned in terms of, researching and understanding from a media point of view is what they said in that particular crisis, the health crisis, is pretty much wear a mask, keep your hands clean, keep your distance, is the same message we are giving 100 years down the line in order to stay safe. What kind of institutional memory that you all had, your organization had, has become helpful in understanding this pandemic and facing it? And what do you think, because you very well know this is not the last pandemic, next one might hit next year or this year. So how are we going to balance that out?
Maybe one small correction, that the IFRC was created in 1919 after the pandemic.
Yes.
So actually, this was actually one of the impact of the pandemic that time was that we needed a global organization to coordinate. So we had the national institutions, but not the global institution. So the end of the First World War and the end of the pandemic actually caused to create the IFRC at that time. But as you rightly said, the knowledge was existing in the Red Cross organizations that time already. And it was quite fascinating to see that some of the measures put in place that time. I saw the pictures of the Red Cross actually stitching the masks, and we had to do the same after 100 years. I think one of the things that has not happened sufficiently in the world is to keep some of these memories. And I think we still have this habit of reinventing the wheel every time the new crisis comes. So that's one of the reasons 2 years ago when we started the COVID-19 program, we put one of the pillars. So we had developed actually 5 pillars of our action. And one of the pillars we put from the very beginning was learning and capturing the knowledge. So the work is going in parallel to the COVID-19 response. So we want to document basically from day one how we planned, how we picked up the knowledge from the past, what are the new things we learned, how we coordinated, how we evolved. That information is being packaged. And we want to keep this as an institutional memory. So while we had that memory, we had to a little bit struggle to get that this time. We want to avoid that situation. As you rightly said, this is not the last pandemic. Unfortunately, there will be pandemics in coming years. So we cannot lose this institutional memory. But this time we have done it consciously and deliberately. So, and of course, with the knowledge of technology, of course, it will be much easier to store data and share in the future. But one big difference between the pandemic that time and this time is, of course, the both positive and negative side of the digital media. Digital media in some way positively helped, but in some cases the infodemics didn't help. And this was something none of us were prepared. And there was no learning from that time we could use. So this is something we want to also capture, the impact of digital tools we have and digital access we have.
Jagan, what do you think? Another 5 years, 10 years, 15 years, we'll be talking about COVID, or what exactly is your institution, sitting at a very higher point, looking at everything that's occurring in the world, understanding a lot of new things that are coming from various organizations. What do you think? What is your take? How long will we have to keep doing this?
My hope is that it will not at the same level as it is now. Clearly, we will have to learn to live with the pandemics, but I believe that by the end of this year, we will already start seeing us moving to a much more different phase of learning to live with the pandemics. Of course, there could be new variants, and of course, there could be new type of pandemics, but on the COVID-19 itself, I will believe that we will be making transition. But for our organization, I believe the biggest crisis we will be dealing with in 5 to 10 years' time would be the crisis linked to climate change.
Sure. In terms of Sri Lanka, are you satisfied with the COVID operations that have run here, and what exactly the government has done and what the people has done, the vaccination program and everything? What exactly is your thought for that?
I'm very careful to answer this question because for the people who lost their families and friends, everything that was done was not good enough, because they lost their families and friends. So that's why I'm more cautious around how to answer this. But from the point of view of what could have been done in a situation where the knowledge was very limited, data was very limited, initially the science was very limited, and in many ways, the decision makers, the experts, had to take decisions with a very limited information. So if we put that in the context, I think Sri Lanka has done its best to manage, at some point, what looked like an impossible situation. So while we saw absolute sympathy and solidarity with the families who lost their family members, I also think that the best effort was made to manage the situation with the information the decision makers had.
Jagan, I really appreciate you coming and taking the time to join me on this program and have this chat with you in your very short period of time here in Sri Lanka. Just a couple of days and you're back to Geneva. I wish you safe travel back then, and I hope to see you in person and not exactly talk to you back in a Zoom conversation or anything as we try to learn from this pandemic. I really appreciate the time you spent here.
Thank you, Mahieash. And maybe my last message, especially to the young population today on Valentine's Day, is the world is full of crisis. As young people, you have to engage in the humanitarian service. So get motivated by this day today to engage in the humanitarian work.
Exactly. Spread some love for humanity.
Absolutely. Spread some love for humanity. Absolutely.
All right. Well, that's all the time we have for you tonight. Thank you very much for watching. Well, as always, remember to stay positive, test negative. I'll see you next time. Good night.